2020. It is now 3:30 p.m. I am the presiding chair, one of two Elmore County representatives, and I will go ahead and call the meeting to order, starting with roll call. Elmore County, Representative Blanksma.
Representative Blanksma, present.
Commissioner Hasbrook, Valley County, are you there?
Commissioner Hasbrook, I'm here.
Yeah. Okay, thank you. Boise County, Commissioner Sturm.
Commissioner Sturm, present.
Thank you. Ada County, Dr. Young.
Jane Young here.
Dr. Epperly.
Ted Epperly here.
Commissioner Laciando.
Commissioner Laciando here.
Okay, thank you, folks. We're moving on with our action items, and I will defer to Director Duke for any changes to the agenda, Russ.
Madam Chair, we have no changes to the agenda this evening.
Okay, thank you. Under new business, we will proceed on with the discussion and vote regarding potential actions to protect the life, health, and safety within the district as to the COVID-19 pandemic, to include a district-wide public health order. Russ, the floor is yours.
Yes, thank you, Madam Chair. I just wanted to take about 5 minutes to walk through a little bit of the history of what led us up to the discussion this evening, and then I'll turn it back over to you. So just for everybody who's watching the meeting, Central District Health serves Valley, Elmore, Boise, and Ada counties. There are already orders in place for Ada and Valley County in regard to wearing masks in public places. So that's not a change, that's nothing new. The Ada County order has been in place since June 26th, and it is far more comprehensive than the Valley County order. The Valley County mask order has been in place since August 11th. Currently, there are no public health orders for Boise and Elmore counties. And clearly, this pandemic is now affecting all 4 of our counties in a significant way. On Tuesday, November 11th, CDH issued a district-wide public health advisory. Included in the advisory were data points that would need to be met for the advisory to be lifted. I also included in the advisory that if any of our 3 major health systems in Boise, St. Luke's, St. Al's, or the VA, implement crisis standards of care, the advisory would be transitioned to an order. Since that time, we have received further clarification from the state on the process by which crisis standards of care are authorized, and they'll be implemented either statewide or regionally when all options and resources among all of the health systems in the region or the state have been exhausted. So that metric was intended to be a backstop, not as the only indicator that would compel CDH's board to consider expanding existing orders. On Tuesday, December 1st, the board was presented with the CDH COVID data that our communicable disease control section manager, Kimberly Link, shares at most meetings. After that presentation and discussion among board members, you requested that I draft orders for your consideration at the special meeting that you set for Friday, December 4th. At the Friday meeting, we heard from leaders of St. Al's and St. Luke's on what they are experiencing. What you heard from them is they are very clearly stressed. Dr. Souza stated, a small increase in community activity, disease activity, leading to admissions will push us to the limit. Dr. Nemerson said, we are beyond the point where we are able to deliver normal standards of medical care. That is a tragedy, and that's the situation we're already in. I considered public comment leading up to the Friday meeting and weighed that against the data we have been collecting since the start of the pandemic and made some modifications to the order. I recommended at that meeting that we be allowed to publish the updated draft for public comment for the board to consider at their next meeting scheduled for Tuesday, December 8th. Unfortunately, the December 8th meeting was ended for safety reasons prior to the board taking us up on the agenda item as an agenda item. And that brings us to today. As we have done all along, we have offered the public the opportunity to provide comment about board meetings and board actions. And we really appreciate that our citizens took the time to express their views on the topic of district-wide public health orders. And I want to make everyone aware, the board and everyone watching, that the majority of the comments we received through our boh@cdh.idaho.gov website, as well as emails that came directly to the board and myself, and generally those were also copied to that link. The majority of the comments we received are in support of the order. Many of the people who expressed opposition to the order do not want businesses and schools to be shut down. This order does not shut anything down. In fact, one of the desired outcomes for implementing the order is to keep businesses and our schools from having to shut down. I believe we should do everything we can to maintain our health systems and to try to reduce the number of people who get sick, who get hospitalized, and who die from COVID. We have already lost 300 people in our district to COVID-19, with 100 of those deaths occurring in the last 40 days. It's not getting better, it's getting worse. As you heard from the governor at his press briefing last Thursday, for the month of November, COVID-19 was the leading cause of death in Idaho. In addition, he stated very clearly that he is relying on local health districts to make policy decisions for their communities. He reminded us that state law defaults these issues to the health districts. That is the role of this board. I believe orders are necessary to place an added emphasis on the few tools we have to try to reduce the amount of infections we are seeing. As expected, infections resulting from the Thanksgiving holiday placed tremendous stress on the health systems. Now we are getting ready for two widely celebrated back-to-back holidays with Christmas and New Year's, and our health systems are already near capacity. If we can keep the disease in check until we have good levels of immunity, I feel like we have succeeded. While we may not all agree on the best path to get there, I think everyone can agree we do not want to go back to March 25th. That was the day our governor issued stay-at-home orders for the entire state. One change to the orders that I want to bring to your attention before you discuss and vote is Section 9, which is for bars and nightclubs. I added, actually it was a revision. So the existing Ada County order that was actually had this section drafted based on guidance we received from the attorney representing bars and nightclubs several months ago when they petitioned you all to open. They recommended that we include a statement that bars and nightclubs will utilize security personnel to enforce COVID-19 safety protocols, including physical distancing. And the change that I am recommending that you consider this evening is to limit that to those permitted for 200 and greater occupancy. It's not reasonable or appropriate, in my opinion, to expect small bar businesses, for example, to have to hire somebody to manage crowds. So with that change, Madam Chair, members of the board, I recommend that you adopt the order as proposed, and I stand for any questions.
Okay, Russ, this is Chairman Nettleton. Would you like, before we proceed, a motion to make that amendment to the security issue in Section M under number 9?
Madam Chair, that would be fine if you want to do it as one motion. or if you want to do that separately. Either way, so what I would be talking about is making that change to the proposed draft order that covers all 4 of our counties.
Okay, so I'm a little bit unclear. Would you prefer that we do the motion to make that succinct?
Madam Chair, I would recommend you include that in one motion as in your consideration of these orders rather than doing it separately.
Okay, thank you. Okay, any further comments before we proceed?
Betty Ann, this is
Hearing
Ted
none.
Epperly.
Yes, Ted, go ahead.
Yes, Betty Ann, I'm prepared to make the motion knowing that after the motion is made and hopefully seconded that we'll have further discussion. So Betty Ann, if you're ready, my motion would be to approve the proposed Central District Health Public Health Order with the change noted for bars and nightclubs, and to rescind the existing orders for Ada and Valley counties, and to lift the COVID-19 public health advisory issued on November 17th.
This is Commissioner Lachiondo. I'll second.
There further discussion before we proceed with the vote on the motion? Okay, hearing none, I will proceed with the vote, starting with Representative Blanksma, Elmore County.
Representative Blanksma votes no.
Okay, Commissioner Hasbrook, Valley County.
Commissioner Hasbrook votes no.
Commissioner Sturm, Boise County.
Commissioner Sturm votes no.
Dr. Young, Ada County.
Jane Young votes yes.
Dr. Epperly, Ada County.
Ted Epperly votes yes.
Commissioner Lachiondo, Ada County.
Commissioner Lachiondo votes yes.
Okay, the vote being a tie, and so the motion will fail for the lack of a majority. So, as my understanding that the advisory will remain in effect as it stands now. Director Duke, do you want to comment on that?
Sure, Madam Chair. So actually the advisory for all 4 counties will remain in effect. The Ada County order will remain in effect, and the Valley County order will remain in effect.
Okay, thank you. Okay, this is, I'm getting some feedback. I'm not sure from who. Are there any more comments to be made before I call for?
Madam Chair, this is Diana.
Yes, Diana, go ahead.
Given that the motion was really to bring Boise and Elmore counties into the fold, I guess, I'd look for sort of a status update from Russ and perhaps from our commissioners in that area on, what are some positive actions that we can do as a board to assist with the advisory, to encourage people to follow the guidelines. Is there any other ideas that you have?
Russ, go ahead.
Madam Chair, I'll defer that to Commissioner Hasbrook and Commissioner Sturm, and as well as Representative Blanksma. And you're welcome to comment as well, Madam Chair. I mentioned Commissioner Hasbrook, they do have a public health order in place. It's just a mask requirement.
All right. Okay, thank you. Elf, would you have any comments?
Yes, Madam Chair, this is Elf. I think we need to continue with the advisory. I guess the feeling I got from a lot of emails, and I appreciate the public, sending their feelings in, and we've read a lot of interesting life stories from folks that have been dealing with this, but you have to listen to the public, and the public is saying they don't want this. And in Valley County, I think we've been doing a really good job. Our numbers are still pretty low, and I don't feel like it's fair to go back to them and say, okay, we're going to put even more restrictions on, and there is a possibility of a citation. I'm really concerned, and I've talked to our director about this, that if we make everybody mad by passing a mandate, an order, when it comes to vaccinating people, I think people are going to dig in their heels, and that's the last thing we need, because that's going to drag it out for another year or 2 years, and we need to get through this quick, and we need to encourage people to keep on what they've been doing, at least in my county.
Okay, thank you, Elt. Ryan, would you like to weigh in on Boise County and what you're seeing up there with the public?
So, yeah, we are, we've climbed a little bit in cases, and, kind of like what El was saying, through the many, many, many emails that I have received over the last week, there has been a very, very stern disregard to wanting an order in place, and folks are very, very have spoken up, and they very, very much do not want an order. I encourage folks to if they are in the at-risk category, and if they if their kids are going to school and so on and so forth, that they do do their best. I know the schools are doing their best to social distance and to wear masks, in between classes and things like that. Our library the library board here in Horseshoe Bend, earlier this week passed a mask requirement in order to enter the public library. So they did do that. And I think that folks just need to take a real hard look and do the best they can to social distance when they can, and to protect themselves. Restaurants up here have all been wearing masks, and that's working out real well. It's I think the public just kind of needs to understand and take care. I don't want to see anybody go through this that does there's no reason for it and there's no need for it, and so I just hope that everybody takes care of themselves and protects themselves the best they can. That's all I have.
Absolutely. Thank you, Ryan. Megan, would you like to weigh in on what you're seeing in Elmore County?
Sure, Madam Chair. I've noticed in Elmore County there's been a substantial uptick in folks wearing masks. And I think it's important that we start working on a message about cooperation rather than compliance. And I think we're losing track of that. And I think that if we start focusing on getting more cooperation, more public interest in different methods to help control the spread, I think we're actually going to have a higher level of success and a lot less negative interaction when it comes to the public. So I've already made this commitment to St. Luke's that I will work however I can to help educate, and wherever I would be helpful, I'm willing to do it. I know that we've discussed on like a legislative and statewide basis different types of PSAs that can be put out. I think that we probably need to discuss that more as far as Central District Health goes. I think there's some options that we could take advantage of, and I'm going to do my best to keep brainstorming. But as far as what's going on in Elmore County, there was very, very little support for this order and a whole lot of pushback on the idea that their representatives to the board might not carry the day, and that other counties might be implementing orders for Elmore County. And I think there was some frustration on that level. But I think with that frustration, if the order did fail, then I think there's also a responsibility on all of us that have said that we want to provide more in the way of cooperation to really work hard at that so that we don't have to get to this point.
Thank you, Megan. This is Chairman Nettleton, and I would echo Megan's observation in our county. Our major retailers have mask mandates in pretty much all of the businesses. And I do see more widespread community acceptance as far as mask wearing and, social distancing. So I am pleased with the community's response that way. However, I represent the people of Elmore County through our Board of Commissioners, And our Board of Commissioners was absolutely unanimously opposed to this order. So we just hope that we can continue, as Megan said, through education to make people wiser on what we need to do. So any further comments before we, yes, who's speaking, please?
Sorry, this is Diana.
Yes, Diana.
You know, I appreciate hearing all your comments, and I certainly appreciate the commitments. I think where we struggle, and this is where we're all just going to have to continue to try and lock arms best we can. I'm looking at the numbers. Today we have 87 Ada County residents in Ada County hospitals with COVID, but in total in Central District 4 hospitals, we have 142 COVID patients. So we have 55 people who are not Ada County residents who are in Ada County hospitals. And the comments that I'm getting from my constituents include being frustrated because they are concerned about being able to access care, and they are already being limited in accessing care. And so, again, it's so trite to say, both to the board, but really more to everybody who's listening, that we are all in this together. We have a light at the end of the tunnel. It's really exciting to see those vaccinations starting. And it may mean, it does mean, we all need to make sacrifices over the next couple months to white knuckle our way to get through this. I want to share empathy with the people who are frustrated out there, with the people who are sick of COVID, who are tired, who have experienced loss. You know, I think I've shared with members of this board, my dad passed away in August, and he was a 40-year educator, and we would have packed the cathedral, we would have packed the Bass Center, we would have had a rockin' memorial for him. And we didn't get to do that. And it really hurts me to think about that, that I didn't get to have that closure. And I want to empathize and recognize to the people who are frustrated out there that we understand how hard this is, but we are begging you to help us get through the next few months so that we don't end up in crisis standards of care. Please help us do what we need to do so we can make it through into 2021 in better shape.
Okay, thank you, Diana.
Madam Chairwoman, this is Megan.
Yes, go ahead. Yes, Megan, go ahead.
If the chair would entertain a motion.
Yes.
Okay, motion for adjournment.
Betty Ann, this is Ted Epperly. We
yes,
still have some comments to make here.
Okay, go ahead. The motion has been made, so go ahead and comment.
Okay. You know, I think that Central District Health needs to really stay focused on two things, because it's the only two things we can really do here. The first is to really continue to push hard for both education, responsibility, and accountability of the public in terms of mask wearing. And the second thing that we need to stay really focused on is group size limitations. Those in the advisory would have been in the order that are in the advisory will stay the same at less than 10. Those are the two things, and the two things really that are most important from a public health perspective to keep the pandemic at bay. And what I would like to add is that I would beseech the community in all four of our counties, all of the citizens, to really hear this. We all have responsibility for the pandemic. We're all accountable and responsible to each other. If we can each do that job of wearing masks, being responsible and accountable for group size limitations, we will do everything we possibly can, and that has been shown to have major impact on the pandemic, on businesses, on the hospitalizations. That is what is under our control. I would totally agree that we don't need to have mandates if everybody will then do their job. And what I would like to just make sure is that we do. Now, I want to make a couple other points here because this is important. For us to take away the mandate, if you will, for masks and group sizes, we need to see the case counts per 100,000 down below 2 cases per 100,000. Right now, we're in the territory of 85 to 90 cases per 100,000. We're 45 times higher than what will take the masks and social gatherings away. People need to understand that. This is 45 times higher than what we need to do to take the masks and social gatherings off. So please, everybody, do your part in terms of making this a success for our communities. And we'll do everything we can as a health district board to make sure that we're doing what we can to keep you as safe as we possibly can. Thank you.
Okay, thank you, Ted. There's a motion on the table for adjournment. Is there a second?
Madam Chair, this is Eld. I'll second.
Thank you, Eld. I want to announce before taking a vote on the motion that our next regularly scheduled meeting is this Friday, December 18th, beginning at 8:30 a.m. Thanks again to the public who has participated with their emails and is listening in. And with that, I will go ahead and call for a vote for adjournment, starting with Elmore County.
Representative Blanksma votes aye.
Valley County.
Commissioner Hasbrook, aye.
Boise County.
Commissioner Sturm, aye.
Ada County.
Jane Young, aye.
And Epperly, aye.
Commissioner Laciando, aye.
Okay. Motion for adjournment passes unanimously. So once again, thank you for your participation, everybody, and have a good evening. Goodbye.
Now.
Okay, thank you. Good evening, folks. This is the Central District Health Board meeting for Tuesday, October 27th, 2020. It is 5:16 p.m. I thank you for your attendance and interest. I call the meeting to order and introduce myself as the presiding chair. I am Betty Ann Nettleton, representing Elmore County, along with Representative Megan Blanksma. And I will now do roll call for our 4 counties, starting with Valley County. Valley County.
Here, sorry.
Okay. Thank you, Elmore County.
Representative